The Business Buzz, an insightful and fresh take on a variety of issues that impact the local business environment. This is where we address the business topics that matter. Here's your host, Sabrina Turner.
Good morning, and time for another Business Buzz right here on Radio Cayman. I'm your host, Sabrina Turner, and our first guest this morning, we're pleased to put the spotlight on Cayman Clinic. My guest in studio is Dr. Denise Osterloh of the Cayman Clinic as we find out what it's like working as a general practitioner and to hear about the services being offered over there. Dr. Osterloh, it's a pleasure to have you on our show.
Morning, Sabrina. Thank you for inviting me.
It's a pleasure, and I'm quite sure it'll be a very informative show. The Radio Cayman's Business Buzz is proudly sponsored by greenturtle.ky. Get your new phone at greenturtle.ky. No stress, no fuss at greenturtle.ky. Also brought to you by Cayman Medical Supplies. Call them at 949-6211 and by Grape Tree Cafe in Bodden Town. Call them in advance to get your fish fry in my opinion, a little drier. Call them at 324-5860. Let's get on with our conversation, Dr. Osterloh. I want to know exactly, let's go back a little bit in time. Tell us how you first got involved in choosing the career in the medical field.
Well, it was a little bit of a sad story. It was years ago when I was growing up in Zimbabwe. I always wanted to be a vet, and unfortunately I was involved in a motor vehicle accident where two of my friends were killed, and I felt really hopeless and unable to help them in their time of need. And I came away with thinking, well, I'm going to go into the medical profession, and from there that's where it came from.
Now, what are your areas of specialty?
I used to be in the emergency room as an emergency room physician. I now work in the Cayman Clinic, and so my area of specialties are general practitioner, family practice medicine, and then obviously with that comes my emergency background, being able to do acute and emergency care as well as hyperbaric medicine.
What has been the most satisfying thing about being a doctor?
There's so many satisfying things. It's a kind of a loaded question. I think at the end of the day, it's just to be able to give compassion and caring and to know that in some way you've helped a person, be it by making them better or not by even making them better, but just by being there for them in their time of need.
Now, you also work a lot with families. Tell us that part of your day-to-day.
That's a very varied kind of day. Obviously, a lot of patients come in by themselves, but a lot of the times there's family issues that do come with that. So you get to meet the family, work with them, help them with the person that's in need. So from that point, it's never just the patient that you're treating. It's a family that comes with them.
Correct. Now, you also have an expertise, or you assist sometimes in the hyperbaric and dive medicine?
Yes. For many, many years when I worked in the emergency room, I was part of Cayman Hyperbaric Services, which was a hyperbaric service mainly offered for diving-related problems, decompression illness. And then we also dealt with wound injuries and things like that. Over the years, hyperbaric medicine has actually changed in many ways, or at least a lot of other applications for it have come about. So we now do quite a few things for the hyperbaric chamber.
Which I'll allow you to expand a little bit more as to how does hyperbaric oxygen treatment work? If it's not used, you usually think about that when somebody gets the bends, they go diving, they come up too quickly. But there are other uses for that type of treatment as well? Yeah,
there is. I mean, at the end of the day, hyperbaric oxygen is basically the body needs oxygen to survive and to function, and it needs it to repair. So I always akin it to if you are carrying a bag full of food, there's only so much food that you can carry in the bag.
Correct.
Same thing with our bloodstream. We have red cells that carry the oxygen, and there's only so many red cells. So what hyperbaric oxygen does, under pressure, it pushes more oxygen into the actual plasma, into the bloodstream, not onto the red cells. And these little, the plasma can get right down to areas where the red blood cells can't go.
Okay.
And it's that oxygen that goes to these areas that are either injured or repairing, and it helps then repair the body.
Definitely enhance healing.
Mm-hmm. Absolutely.
Now, Dr. Osterloh, can you share a little bit about your work into especially emergency and acute care? Having worked at the Georgetown Hospital back in the day, have you find that you've actually been put in the spot to do this now that you're at Cayman Clinic?
Yes, we deal with emergencies pretty much every day. It can be very mild emergencies, but we do sometimes have people coming straight to us with acute chest pain, for example, that we may have to exclude a heart attack, a myocardial infarction, or they come in acutely short of breath, and that could be, for example, like a pneumonia or a pulmonary embolus. And we get people with head injuries and lacerations. So it can be very varied. It's not just your daily routine stuff.
Right.
So anything can walk through the door.
Can you share your services that you offer as it relates to minor surgical procedures?
Sure. Minor surgical procedures, basically myself and the other docs at Cayman Clinic, we offer these minor surgical procedures. For example, evaluation of a skin lesion and removal. If you have something, for example, like a small lump or bump that may be a sebaceous cyst or an abscess, we can assess that, treat it, and surgically remove or whatever we need to do with that. Those are sort of the non-urgent kind of procedures.
Correct.
Yep.
Now, when it comes to women and men's health, what does your services include?
Basically, if you're coming in and you're wanting a health wellness check, I like to look at the patient in a holistic manner. So obviously, it's mind and body. We take their age into account. We take their background medical history into account. We also take what they want out of the consultation and what they want to do for their health in the future. And we apply that to guidelines, and we then tailor-make, after examining them, a sort of a format of, yes, let's do this, let's do bloods, let's do your mammogram on a yearly basis or whatever it may be. So despite having guidelines, we like to tailor-make it for the person and make it more patient-orientated.
We're going to take our first break this morning right here on Radio Cayman's Business Buzz. And I'm speaking with Dr. Denise Osterloh and putting the spotlight on Cayman Clinic. When we come back, we'll talk a little bit about children and adolescents' health care, talking about hormonal imbalance, and that may open up another conversation that women are not probably opening up enough and going through all of these changes and so forth, and just crazy trying to figure it out.
Absolutely. That's what we're there to help them.
Keep it locked to the Business Buzz for more when we come back.
You may have heard of them by now. GreenTurtle.ky, a one-stop shop for your mobile needs. Whether shopping for a new phone or topping up a loved one, it's time to hop aboard the Green Turtle Express. From 24-hour delivery in Grand Cayman to sending credit worldwide, GreenTurtle.ky is the future of mobile. Take a ride on the Green Turtle Express today. GreenTurtle.ky. They get there first.
Oh gosh.
Don't let the stress of taking care of loved ones get you down.
Home care, now made easier with Cayman Medical Supplies. 100% Caymanian owned. Cayman Medical Supplies now stocks a wide range of home care supplies. Hospital beds, all types of wheelchairs, including beach access wheelchairs, lifts, commodes, shower chairs, walkers, Curad brand orthopedic supplies. Free blood glucose monitors with the purchase of 1 pack of test strips, blue underpads, and a whole lot more.
Need home care convenience? Drop by Cayman Medical Supplies at 93 Smith Road, Windward Center, or call 949-6211. Free delivery. The 2018 Fall Labor Force Survey is currently being conducted by the Economics and Statistics Office ESO. The LFS collects data on the employed and unemployed persons. Trained interviewers with ESO ID cards will visit the randomly selected households in all districts. The interviews are confidential in accordance with the statistics law. No individual data will be published or disclosed. Survey data are exempt from freedom of information. For more details, please call the ESO hotline at 516-3329.
Welcome back to the Business Buzz, the business topics that matter, an insightful and fresh take on a variety of issues that impact the local business environment. Cayman's Business Buzz.
Good morning and welcome back to the Business Buzz as we keep the spotlight on Cayman Clinic, and I'm speaking with Dr. Denise Osterloh. One of the most respected professions is that of a doctor. Doctors have dedicated their lives to serving humanity and providing medical care to all those in need. The impact they can have on someone's life is priceless. Is there even a word of the impact a medical can have on someone's life?
I think that you can't quantify it.
Mm-hmm.
I think
you
it's
can't
difficult.
measure it at all.
That's it.
But it's a pleasure to have you in studio to talk and allow us to put the spotlight on your organization. It's a group of medical professionals there. But before that break, I mentioned that I wanted to speak a little bit about child and adolescent health, including hormonal imbalances that you may be seeing today.
Yes, over the years, I think, most parents will take their children to a pediatrician. We provide more like a secondary backup to that. But as children and kids become adolescents, there's that grey area. Do they still go to the pediatrician or not? And especially more with young females because they tend to undergo a lot more sort of hormonal changes in quick succession. But we do get the young men coming in as well. So they do present to us with a lot of issues relating to those sort of hormonal problems and then the psychological things that come with it.
Right.
So, we're very open and we love to manage them and help them.
Now, I'm always going down this road with women since we're speaking about hormonal imbalances. And we all know that women go through their phases and so do men. But what have you seen in women coming in and having the discussions, the conversations? Because a lot of them are confused with what their bodies are going through. It's like they're going crazy.
I think we're lucky comparative to like our parents' days. I mean, a lot of, I know for a fact my mom never talked about menopause. It was just something that was just kept quiet and you just went through it. So thankfully women are a lot more aware of it and able to open up about it. And we've also got a lot more to be able to manage them, not just on a medication basis, but on a holistic herbal basis, complementary care, all stuff like that. Because it's really, really important. Some ladies are lucky enough to have no issues. Correct. And a lot, really, really struggle. So, we're here to help them go through that minefield.
For those... What do you think people should be embarrassed if they actually find themselves going through menopause? Because some of them are a little embarrassed with their significant others or their husbands, and some have the flip of the wrist and says, "Oh, she's just going through her time." How can you dispel that and understanding that there are a lot of emotions that are going through when a woman is going, feeling?
Yeah. I think the biggest step is if they come in that we know that they've made that step. It's the ones that don't come in that suffer in silence out there and are maybe put down by society or put down by their partners or even by some other females. But at the same time, once they come in and they open up, they do realize that, somebody does care, someone can help, and that's what we're there to do.
Now, you've always, switching the topic now, you've always had an interest in animal protection and rescue services in the community. Can you share with us a little bit about your works relating to canine friends and healing paws?
Yes, everyone that knows me knows that I'm a little bit of an animal nut and that I have a big zoo at home. But I think, kindness and compassion starts with every living creature, no matter how small or big or whatever. Anyhow, I've always worked with rescue organizations on the island, one particularly Canine Friends. There are obviously Humane Society, PAWS, and a few others that we help with. But I've always loved the concept of animals as a healing conduit for people in need. And I was lucky enough about 5-6 years ago that one of the ladies that was dealing with this situation handed over Healing Paws to me, and we've grown it into a much bigger entity, and it's fantastic. We go to the Pines with our doggy companions, and we have a lot of good times with there. We also have a few ladies out in the community helping children in need, and we're planning to expand more with this.
Excellent. You're a medical professional, and here you have dogs that can be very therapeutic when it comes to healing. What have you seen? Have you actually used some of those? Or have you used that as a therapeutic way?
Yes, we do. I mean, these dogs, I can't elaborate more, but they go into troubled situations, especially with young kids that are having maybe learning disorders or disabilities or problems just relating to society. And the dogs are a very good source of helping them realize that somebody cares for them, and that comes and helps with their healing process.
I want to get your thoughts on these support animals now that we're seeing blowing up the headlines. Support animals can be from a donkey to a turkey, and then you have your traditional, dogs. What type of services do you get if someone feels that they need an emotional support animal to travel or to always be with them? Is there any, to the best of your knowledge, are there any regulations to support that?
Well, I think, like everything, it starts off with good intentions and then people abuse it. And unfortunately, that's what's happened a lot with people traveling with animals and saying that they are a therapy dog or animal, and then it goes to extremes. Obviously, any animal has the ability to be an emotional support to that person.
Correct.
But obviously, we have to have guidelines and people have to follow it. I have a patient that has a little emotional support bunny. So, and she does travel with it. And, this little bunny really does give emotional support to this young girl that really needs it. So I think it's got to be in moderation and it's got to be properly vetted.
So for someone not understanding the impact of an emotional support animal, how are you able as an individual to decide, well, there is an attachment? We all love our pets. You love our pets. But do you have to travel with every one of your animals that's in your yard?
No, you don't.
That's what I'm trying to define. How do you get to that point?
I think it really is the individual. It's an individual that's gone through problems, maybe psychological, psychiatric, has come up through the ranks, has maybe had treatment, and it's not fair, it's not worked, or it's not been 100% successful. And somewhere along the line, someone says, well, what about this? What about an emotional support? And that's when that final sort of like link in the puzzle just chips in, because I do have patients, and they're genuine patients that have issues that modern medicine has not helped, and the emotional support dog is really good for them when they travel or etc. But these are animals that have been properly trained, and they come from proper organizations. So it's not just your dog from the backyard that just decided to go on holiday with you.
Point well taken. You're in tune to Radio Cayman's Business Buzz as we put the spotlight this morning on Cayman Clinic, chatting with our doctor, Dr. Osterloh, who is a graduate from the University of Cape Town, South Africa in 1988, gained extensive experience internationally working in family practice and emergency medicine with nonprofit practice relief organization. She joined Georgetown Hospital in 1997, emergency room physician until 2011, and went over there at Cayman Clinic ever since. Now, that clinic is offering a wide variety of medical professions. You want to share other services that can be tapped into at Cayman Clinic?
We have Cayman Clinic. We actually have quite a few doctors now, and we have a new doctor, Dr. Heidi, who's joined us. So we offer obviously a very vast range of family practice, general medicine, female and male healthcare, the stuff that we kind of talked about a little earlier on.
Correct.
But we also have ultrasound services. We have Nina Baxter, who's our ultrasonographer. We also have next to us, we have the Trinke, the gynecologist, and at the back of us we have Back to Health, Dr. Roya, who's a chiropractor with her team. So we've been trying to offer a huge complementary care in many, many ways, and we do hope to be able to help people if they don't feel that one service is not right for them, that we can pop them into the right channel.
Where is Cayman Clinic located, and how can persons get additional information?
Cayman Clinic is just off Crew Road. We do have a Facebook page, Cayman Clinic. We do have a web page, which is in the process of just being redone, but it's still open. So if you just Google Cayman Clinic, it will come up. So easy enough to contact us through that, or you can certainly call us at 949-7400.
We'll take a break. When we come back, we'll get some tips and advice for persons who are aspiring doctors or want to take up a career in the medical field, and what's in the future for not only yourself, but where you see the clinic going. Stay tuned for more when we come back.
You may have heard of them by now. greenturtle.ky, a one-stop shop for your mobile needs. Whether shopping for a new phone or topping up a loved one, It's time to hop aboard the Green Turtle Express. From 24-hour delivery in Grand Cayman to sending credit worldwide, greenturtle.ky is the future of mobile. Take a ride on the Green Turtle Express today. greenturtle.ky. They get there first.
Oh gosh.
Don't let the stress of taking care of loved ones get you down.
Home care, now made easier with Cayman Medical Supplies. 100% Caymanian owned. Cayman Medical Supplies now stocks a wide range of home care supplies. Hospital beds, all types of wheelchairs, including beach access wheelchairs, lifts, commodes, shower chairs, walkers, Curad brand orthopedic supplies. Free blood glucose monitors with the purchase of 1 pack of test strips, blue underpads, and a whole lot more.
Need home care convenience? Drop by Cayman Medical Supplies at 93 Smith Road, Windward Center, or call 949-6211. Free delivery.
Welcome back to the Business Buzz, the business topics that matter, an insightful and fresh take on a variety of issues that impact the local business environment. Cayman's Business Buzz.
Welcome back to the Business Buzz and keeping the spotlight on Cayman Clinic and having a chat with Dr. Denise Osterloh. Cayman Clinic is located over there at 439 Crew Road. That's opposite Melody Lane, right here in Georgetown. And you can give them a call, 949-7400. Now, if someone is thinking of becoming a doctor or just taking up a career in the medical field, what advice would you tell them about this? Well, let's go with the doctor, the profession, because it's broad.
I think you have to want to do it because you love the thought of helping people. You have to have the compassion. It is hard work, and it's a lifelong commitment. There's lots of rewards, but with those rewards goes a lot of heartbreak, a lot of heartache, and a lot of kickbacks where times can be hard and you wonder why.
Correct.
But at the end of the day, I can't voice enough, you've got to have compassion because sometimes we can't treat, we can't help, but we can care in that, and that's the thing. But at the same time, thankfully we do have the people that have the brains that want to go and do research and they don't have compassion because they're going to go into a non-clinical field.
Right.
And we need them just as much.
Exactly.
So just be aware of what you may be getting into and just realize that it can be hard, but it's worth it all.
Now, from you deciding to become a doctor to where we are today, how has, patient care evolved? You find that there's less interaction one-on-one to a certain degree and more paperwork?
I think over the years, definitely more paperwork because with that came legality of everything and making sure you'd crossed your T's and dotted your I's and in case of issues. But with that's also changed because we've had the advent of computers, so things have become a lot easier in that way. But at the same time, I think the actual consult, the one-on-one patient-doctor thing has never changed. Okay. That confidentiality. What has changed with it is what we've been able to give the patient and the care and the investigations that we can do. All of that has changed because we've got so much more at our disposal. Right.
What's your take on artificial intelligence in your industry?
Oh, Big Brother watching.
Like doing surgeries, just making your life much easier. And, that's a competition with even you having that hands-on experience in doing surgeries. When you're having robots or you're using modern technology now to do certain procedures.
I think that's one thing that has changed. We are so able to do a lot more with hands-off. I wouldn't say it's a bad thing. Okay. I think at the end of the day, though, you still will need a human somewhere along the line with it. So as long as it's in concept of what is needed and what's right for the patient. But at the end of the day, all computers can break down. So you need to have a human there.
And that's right. Dr. Osterloh, what can we expect from you in the coming months at Cayman Clinic?
Gosh, that's a loaded question. I'm there with our team always for patients. We hope to be able to still continue the good care that we have at all times. As I say, with new doctor Heidi Fahy, we're hoping to be able to have more people come to us and have more time for other people. And we do have some other little things in the woodwork that we would like to promote. They're not quite off the ground yet, but we want to at least progress so that we can continue with good quality care for our patients.
Are you seeing persons taking more interest in preventative, medicine than actually just waiting for disaster to strike and then finding you?
Thankfully, yes. A lot more people are aware of wellness and coming in and checking up before things happen. Luckily, some people do have that option with certain insurances and stuff. And the people that slip through the cracks are the people that don't have good insurance.
Okay.
And they're the hard ones. They do come in when it's crisis management, and that's sad because everybody should have the same access.
It's true. What advice would you leave to our listening audience this morning as it pertains to, just investing in oneself, but mostly one's health? You only get one shot at this life.
Absolutely. I think as much as we like to live hard, work hard, play hard, at the end of the day, the body is a sacred organ and it really cannot cope with a lot of stresses. Look after yourself, try and be preventive, try and look after your health before things go wrong. Moderation.
Yes, everything.
Yep.
Any special mentions, thank yous that you would like, or again, you can recap whatever you'd like to leave with our audience this morning?
No, I'd just like to say thank you to all my patients that have allowed me to help them through their journey and still do, as well as I've been very fortunate to be able to work here in the Caymans through Georgetown, through Cayman Clinic. We're able to provide a wonderful healthcare comparative to some other countries where our hands are tied in many ways.
Correct.
So it's been a very wonderful journey, and I'm very thankful to be able to provide it and still do.
Good for you, and thank you for what you've done and for the service that you've played. What are the hours of operation of Cayman Clinic?
At the moment, we're open from 8 to 5, Monday to Friday, Saturday mornings from 9 o'clock to about 1:30. We do provide certain after-hour facilities if people are in need. But for the most part, that's our hours. We are hoping to extend those as time goes on.
It has been a pleasure. Perfect timing as well, so that we can expand on the services offering at Cayman Clinic, and we want to wish you all success.
Thank you, Sabrina, for having me.
The Business Buzz is brought to you every Tuesday and Thursday from 7:30 until about 9 o'clock. At every other Tuesday, because Money Sense is before, we have a shortened show. It has been my pleasure. Every Thursday, It has been my pleasure. Until Tuesday, have a safe and fabulous Thursday.
Oh, Cayman moon.
The voice of the Cayman Islands, Radio Cayman.
Shining down from above.
We love our listeners.
Radio Cayman in the Cayman Islands.